Good morning. I'm Judy Evans and I'm a plastic surgeon, and I'm on the council of the Royal College of Surgeons of Edinburgh, and most recently I've become the Honorary Secretary for the college. As a college, we don't have undergraduate students, but what we do as the first level for people coming into contact with us is to do an examination called the MRCS, which is taken by people who are really at the gateway to surgical training. It's very important for surgeons to know their basic sciences, but most particularly anatomy. Nobody would want to go to a surgeon who didn't know which way around their body they were going. So we have a two-part examination. The first part of the examination is a multiple choice type of examination, which is very tough, but is very fair, and it's quite long, but it's all done on one day. And this covers the whole of the syllabus of anatomy, physiology, pathology, and to some extent some of the matters which we have to deal with in intensive care, which can be dealt with in a remote setting for assessment and examinations. When a student has passed the Part A, which is that part of the exam, they're then eligible to take the Part B. When they do the Part B, we have separated it out from being 1 day of vivas and 1 day of clinicals. We've now put it all together so that what we do is an OSCE format. So the candidates will come in front of us and they will see 18 bays or 18 OSCEs. In those 18 bays, they will be tested across the breadth of the syllabus of general surgery, a little bit on plastics, for example, burns, some orthopedics, and a little bit about the other specialties as well. So when they pass the MRCS Part B, they're allowed to put MRCS Edinburgh after their names. And then we in the UK use that qualification as the benchmark so that they can begin their specialist training. It's very important that this is something which has a career benchmark or step in it, so that in the UK people can train up until what we call ST3, that is maybe the 4th or 5th year out of medical school, without the MRCS, but they cannot progress beyond that point without having passed the MRCS. There are 4 royal colleges in the United Kingdom and Ireland, and we represent the Edinburgh College, which has a long history of being international. So we have been coming to Chennai for many years, and what we hope to do in the future is to have the exam here every year. Up until recently, we have had the exam in Chennai every other year, but we're very well aware that the demand is increasing, and we are going to work towards putting the exam in place every year. We do have 4 centres in India at the moment, and we're in negotiation as to the timetable over the coming couple of years as to where the examination will take place. One of the really important things about passing this examination is that it is an international benchmark. So when we do the exam in Chennai, the paperwork all goes back to the UK and the results are centrally assessed. That is very important in 2 ways. It means that if a question seems to be unfair, we can exclude that question from the ultimate result. So when someone is taking an examination and everybody in one centre turns around and says, that's not fair, that question was inaccurate, because we take it back and have it centrally scrutinised, we can be we can finesse things very nicely to make sure that unfair questions are never asked and will never be held against a candidate. The examination is taken in conjunction with the other royal colleges, but it will in India be the MRCS OSCE examination (Edinburgh). We have also realised that the OSCE format is something which is new to many candidates. We find that back in Britain, candidates find it quite strange when they first begin to think about being examined in this way. And certainly we found across different cultures, it can cause difficulty if people who are putting themselves forward as candidates have a great knowledge of the facts, but they don't know how to express themselves. We work in a world where communication and informed consent, and I'm afraid litigation, is becoming more and more a part of everyday practice. And if we as a Royal College are setting standards for the future doctors, we actually have to put an examination in place which is relevant to what they're going to have to do in their everyday life into the future. And that is why we have realized we cannot just go to places and hold an exam. We have to provide education in the form of our prep courses before people take the exam. So we have done many prep courses in India.